The disease process that we will be discussing and evaluating is acute lymphoblastic leukemia, and your presenters are Jesse Harris, Emily Julian, Taylor Brown, Brittany Freeman, and Addie O'Connor.
This is just an overview of each person who took over what sections. So we're going to talk about the pathophysiology of acute lymphoblastic leukemia. We're also going to talk about the risk factors, the clinical manifestations, the complications, diagnosing and treating this cancer, and then give an overview of everything that we've talked about.
Okay, so for the pathophysiology of acute lymphoblastic leukemia, first you need to understand that acute leukemia is a cancer of the leukocytes. So the bone marrow makes abnormal leukocytes or leukemia cells. Acute lymphoblastic leukemia specifically is aggressive, fast-growing, or excessive number of lymphoblasts. What happens is there are chromosomal alterations that interrupt normal B and T cell differentiation, and this interrupts the normal differentiation of lymphoid precursors and produces malignant leukocytes. These malignant leukocytes then proliferate and causes a complication known as pancytopenia. So these are when leukemia cells do not die when they're supposed to, so they begin to crowd out the normal leukocytes, erythrocytes, and thrombocytes, leading to complications of bleeding, anemia, and infection, because those are the normal functions and preventions of healthy cells. And then these malignant leukocytes can proliferate and spread into the spleen, liver, and lymph nodes. The exact cause is unknown, but it primarily affects children and accounts for approximately 75% of all childhood leukemias.
Up next are the risk factors. These are variables that increase a person's chance of developing a specific disease. So for acute lymphoblastic leukemia, they are as follows. There's a tendency to reappear in families, an increased incidence associated with other genetic abnormalities, for example, a person with Down syndrome. In adults, long-term exposure to cigarette smoke, benzene, and ionizing radiation. And then those with HIV and hepatitis C infections or other immunodeficiency disorders are at much higher risk of developing acute lymphoblastic leukemia. There are three main complications that happen with acute lymphoblastic leukemia. The first one being anemia happens due to an overcrowding of lymphoblasts, so therefore there's not enough space in the bone marrow for erythrocytes to develop. And if they don't ever develop, then we don't have enough red blood cells to carry out the oxygen needed to the body. And then bleeding, this would also happen due to an overcrowding of lymphoblasts, and so that results in low levels of platelets, which are our clotting factors and help clump together to stop bleeding. And then the third one is infection, and this is because lymphoblasts are large, immature leukocytes, and so because they're immature, they're not fully equipped to fight off infection.
Next are the clinical manifestations of ALL. Those include fatigue, bleeding, specifically in the skin, gums, and mucous membranes. Petechiae, which is pinpoint round spots that appear on the skin as a result of bleeding. Ecchymosis, which is bruising or skin discolorization that results from bleeding underneath the skin. And hematuria, which is blood and urine. Also, fever, bone pain, anorexia, weight loss, and additional central nervous system involvement, which includes leukemic infiltration and bleeding, headache, vomiting, and blurred vision.
So now we're going to talk about diagnosing acute lymphoblastic leukemia. So initially you're going to go with your typical history and physical examination, and then to further discover what's going on in the body, you're going to do a peripheral blood smear, a bone marrow biopsy, and a complete blood count. And you can do all of these, you can do one of them. It really just depends on what's going on and everything that the physician feels that we need to find out. So now we're going to talk about treating acute lymphoblastic leukemia. So this actually includes two treatment phases: remission, induction, and post-remission. So treatment for this is going to include chemotherapy, a bone marrow transplant if chemotherapy is not successful. You can also consider targeted therapy, stem cell transplant, surgery, a donor lymphocyte infusion, radiation, along with biological therapy, and one more thing would be prophylactic central nervous system chemotherapy. So all of these things can be done to treat this cancer and basically it all just depends on the extent of the disease, the extent of the cancer, what stage and what all is the patient experiencing. And so it's all just based on how severe things are and the best treatment for the patient.